Good evening, everyone. Presenting from Fakir University Hospital. My name is Sapna, and as part of Surgical Institute, I have with me Dr. Omar Al Darwish. He is a consultant urologist with more than 20 years of experience in managing urological conditions in UK as well as UAE. So, welcome, Dr. Omar. And today I have received inputs from you that why not we speak about minimal invasive surgeries in urology. Am I right?
That's right. Yes, that's right.
So, Doctor, we will start with just a couple of discussion regards to few questions what we have it, and we also have it from the audiences. And I'll be happy if you can help us understanding more about these conditions more. So, speaking about surgeries, Doctor, if you can help me, how do you define minimal invasive surgeries?
Thanks very much, Sapna. So minimally invasive surgery is using technologies to try and minimize tissue damage by reducing the size of cuts or incisions that allows us to enter to the body and offer treatment to the patient. So instead of having big cut for open surgery, we use a small, less than 1 centimeter incisions, or sometimes we use natural orifices to go inside the body and do the surgery with minimal damage to the tissue.
Okay, with minimal damage to the tissues.
Yes.
And doctor, are there any kind of different types of minimal invasive surgeries in urology?
Yes, that's right. We have at least 4 types of minimally invasive procedures in urology nowadays. One of the first is the endoscopic surgery that uses small cameras with sheets and working channels to go through the normal water passage to the bladder and to the kidney and kidney tubes and treat any conditions of the urinary tract without the need for cutting or incision. There is also laparoscopic or keyhole surgery where we make small incisions, and that allows us to introduce tiny cameras as well as small instruments to do the surgery with minimum incisions and with very precise techniques.
Okay, doctor. So there are different types of minimal invasive surgeries.
The third one is, which is the more advanced one, is the robotic assisted surgery, which is similar to laparoscopic surgery with the use of computerized instruments to replicate the hand movement inside the patient body. That will allow us to perform very complicated procedures with minimum, of course, effort to the surgeon, as well as using 3-dimension cameras that will give a magnified image to make the surgery more precise and accurate.
Okay, so it's good to know about the robotic assisted surgeries, because we do get to read a lot about the new era of the minimal invasive surgeries which is coming. Doctor, are there any examples which you would like to state for minimal invasive surgeries in urology apart from the types?
Yes, so minimally invasive surgery now is the main way of procedural surgery in urology. For example, in endoscopic procedures, we can treat prostatic conditions like benign prostatic enlargement, where we remove the blocking part of the tissue using endoscopes without any outside cuts. We can use different types of energy to remove the tissue by electric cautery or laser. We can also treat kidney conditions like benign or malignant conditions with laparoscopic or keyhole surgery, like removing the kidney tumor or even removing part of the kidney that is affected by the tumor and preserving the rest of the kidney, which is called partial nephrectomy. In the old days, if you want to do partial nephrectomy, for example, in using the open technique, we need to have a cut as big as this. Instead of this, with the keyhole surgery or laparoscopic surgery, the cuts are maybe 3 or 4 small, less than 1 centimeter cut. This allows the patient to recover quickly with minimum pain, and they can go back to their daily life in a very short period of time.
So I understand faster recovery, minimal pain, going back to routine in a short time. Are there any other advantages, doctor, when it comes to minimal invasive surgeries?
Yes, of course, because if we imagine open surgery needing big incision, this comes with possible complications like bleeding, wound infection, severe pain that will necessitate longer stay in the hospital and needing more painkillers and analgesia. This will in turn lead to more complications. So these are the advantages. In addition to this, when we are using the cameras, we can have magnification of the tissue that will make the procedure more precise and more accurate, and it will allow us to do more complicated procedures with minimum damage or injury to the tissues.
Okay, minimal injury to the tissues and minimum damage as well. Doctor, this is helpful. In fact, it's very useful for us to understand about the advantages. Are there any recent advances in minimal invasive surgeries, or do you want to state anything to us that we should really know more in detail about it?
Yes, thank you. So size matters, and the smaller the organ or the smaller the tube that we enter, the more difficult it becomes. So one of the major advances in the urology is the small flexible ureteroscope that allows us to go through the kidney tube up to the kidney and also navigate inside the kidney to try and treat any condition like kidney stones or small kidney lesions or tumors. In addition, we have the robotic assisted surgery, laparoscopic surgery, where instead of using fixed solid instruments, we use articulated instruments that is connected to the computer and replicate the hand's movement inside the body. And this allows us to do more complicated procedures with better, of course, outcome. In addition, it is more comfortable to the surgeon that using this robotic assisted surgery allows us to do longer procedures with less impact in our or less risk of fatigue that will keep the focus and concentration of the surgeon for the whole time of the procedure, which allows us to have better outcome. In addition to the other advantages of endoscopic surgery, as I mentioned, quicker recovery, less pain, and less complications.
Okay, that's good to know, doctor. So the complex procedures can be done with better precision, better outcome, and patients, they recover faster and they go back to their work in a less amount of time compared to the open surgeries. So this was helpful, Dr. Omar, and thank you very much. Signing up from here. Thanks, Dr. Omar, for your time in teaching us, guiding us regards to minimal invasive surgeries in urology. Thank you.
Thanks very much. Thank you.
Thank you so much.